So, my name is Olivia, and I have been struggling for years with really severe treatment-resistant major depression.
I was diagnosed with crystal storing histiocytosis, one of 80 people in the world to be documented with that.
I'm 38 years old with Duchenne muscular dystrophy.
So years ago,
is
I
a
was
genetic
first having
disease that mainly affects the respiratory system and the digestive system. Yeah, for me, liver disease, which was something.
well.
In the United States, the practice of a healthcare profession is based on where a patient is located at the time the care is delivered. If I'm a physician and I'm seeing a patient via telemedicine, I have to be licensed where that patient is located during the visit. Now, pre-COVID, we actually did interact with patients across state lines. For telemedicine visits, there was this restriction, but for ages, we've been talking to the patients over the phone, we've been MyChart messaging with patients, and we did not ask where they were. During COVID, most states said, it's okay, you can see patients into our state and we won't do anything to you providers. So although we had a telemedicine office pre-COVID, we only had about 80 telemedicine visits per month. All of a sudden, 70% of our outpatient visits by May of 2020 are telemedicine. And then all of those waivers started to expire as state public health emergencies expired.
8 years ago, I was diagnosed with a very rare disease, and my doctors here in Asheville, North Carolina are very good. There's a cancer center, but they told me up front that I would need someone who specialized in my disease because they had read about it but had never treated it.
Specifically with this community, we really rely on specialists, and they can be across the country anywhere.
When your child is considered to be terminal, who has something like osteosarcoma, you don't have the luxury of time.
There's a difference between routine care, and these unique situations.
So I was diagnosed with cystic fibrosis when I was 3 months old. I grew up seeing my doctors like my entire life. So the fall of 2020, I went off to college and got super sick, developed pneumonia, and went into liver failure. I was at the local hospital who wasn't set up to treat me because of the complexity of my condition.
There are urgent situations across our country, and we hear from our patients frequently, where patients are really needing to receive cross-state care today, and they can't because of state-based licensure rules, including cancer care, transplant care, rare diseases, college student mental health, and clinical trials from an innovation standpoint. And so we really want patients to be able to connect with their providers and with their families, regardless of geography, so they can get the care they need.
Here we were, my father just having had his first stroke, he couldn't function.
Eve is in San Francisco, François in Baltimore, Philippe in Florida. So the only way that they could have been involved, and their involvement was critical, was by Zoom in ways that could have been life-saving.
A lot of what Maggie needed wasn't a physical exam. It was a conversation. It was, what tests should I be getting next? What did my labs look like?
It also affects continuity of care, for example, when somebody moves around, and provider shortages, especially those who are in rural parts of the country.
It's ridiculous to even think that there's restrictions on telemedicine. Why would you put a restriction on that when it comes to someone's life?
Where treatment across state lines is essential.
It's not like I could just go to an MD. It's down the corner, a primary. I can't do that. I need to see a specialist. You need to walk in my shoes to understand what telehealth can do for me.
Few good things came out of COVID, and this was, one of them. And I think it's like, let's learn from what actually worked.
10 years from now, I want to look back at this time and think, we did not let that crisis go to waste. We harnessed the learnings that we had from COVID, and we figured out a way to move forward and solve this issue to really positively impact the lives of patients.
We know it can be done, and it has been done, and it's something that we have to do.